Hello, everybody. My name is Mayan, and welcome to my presentation. This is the effects of neonatal treatment with the TRPV1 agonist, capsaicin, in an adult rat brain and behavior experiment. So, a little background information. Schizophrenia is characterized by thoughts of experiences that seem out of touch in reality, disorganized speech or behavior, and decreased participation in daily activities. Patients are also known to have reduced sensitivity to heat and pain. This response is painful to stimuli, is yet to be understood by researchers, but this TRPV1 relationship with capsaicin might be useful for understanding the reduced sensitivity to pain in patients with schizophrenia. And TRPV1 is also capable of detecting heat above 45 degrees Celsius, and that range is generally when we start feeling uncomfortably warm. It's also capable of detecting capsaicin, which binds to the TRPV1, allowing for calcium and sodium to pass through the membrane, depolarizing, causing action potentials on the ipsilateral side of the spinal cord, crossing over to the contralateral side of the spinal cord before the signal transmits to your brain, indicating a burning, stinging, or itching sensation. And if you didn't know what capsaicin was, it's a chemical component that belongs to peppers. Research topic was the present study investigated the possible role of TRPV1 channels in schizophrenia by determining whether the brain and behavioral changes previously found in capsaicin-treated rats at the 5 to 7 weeks of age persisted into young and older adulthood, where the pre-pulse inhibition was disrupted, and where the cutaneous plasma extravasation responses to methylnicotinate and prostaglandin D2 were reduced. The way they went about their methods, they had three groups. The first was a novel environment, second was induced with pre-pulse inhibition, and second was exposed to cutaneous plasma extravasation. And the drugs they used throughout the study was capsaicin, Evans blue dye, methylnicotinate, prostaglandin D2. And to start with, the first set of rats was with capsaicin treated. They were placed in observation chamber with other test subjects and were given doses of Ventolin to help with respiratory difficulty induced by capsaicin, and this method allowed for a 90% survival rate. Second group with behavioral assessment. 12 rats were observed from 12 to 14 weeks of age in photocell cages with the speaker mounted 24 centimeters above the chamber, producing continuous 70 decibel background noise, which the rats were acclimated to for 5 minutes before testing started. And a single pre-pulse inhibition test lasted about 45 minutes, consisting of high and low stimulus combinations of 10 decibel blocks. And then the cutaneous plasma extravasation group, they had responses produced in rats by the intracutaneous injection of niacin, methylnicotinate, prostaglandin D2, and capsaicin, which were visualized by leakage of Evans blue from circulation. The control and capsaicin-treated rats at 12 weeks of age were anesthetized with sodium pentobarbital, 40 milligrams kilogram intraperitoneally, and given Evans blue 50 milligrams per kilogram intravenously into a lateral tail vein. Results for this experiment for Figure 1 showed an effective neonatal capsaicin treatment on rats at 12 weeks of age. Mean body rates of male and female capsaicin rats, as well as their relative growth rates, were not significantly different from those of control rats. The brain weight data showed that there was a significant effect of capsaicin at 12 weeks in males, but not in females. The tail length of capsaicin rats were significantly shorter than that of control rats at 12 weeks, but did not differ significantly. Figure 2 showed that effective neonatal capsaicin treatment of response to a novel environment. The response to a novel was observed at 6, 8, 10, and 12 weeks of age, performed over a total of 10 counts of 10-minute locomotor activity, climbing, rearing, and stereotypy, showed that age, but not treatment or sex, significantly affected behavior. And the scores at each age revealed that 6 weeks, but not 8 or 10 weeks of age, 8, 10, or 12 weeks of age, capsaicin treatments were significantly more active than the controls. With Figure 3, the effective neonatal capsaicin treatment on repulse inhibition at 8, 12, and 14 weeks of age. Expected startle amplitude in response to the 115 decibel tone was reduced when preceded by the pre-pulse compared to pulse alone startle amplitude. Pre-pulses of greater amplitude induced greater pre-pulse inhibition, and this was significantly increased with age and also in capsaicin-treated rats compared to controls, and this effect was dependent on pre-pulse intensity. The biggest take-home message I got from this was that the neonatal rats with TRPV1 agonists and capsaicin produced neuroanatomical changes that might be expected in an animal model of schizophrenia, which persisted into adulthood. However, a deficit in pre-pulse inhibition to acoustic startle was not found in these animals, and in this respect, the capsaicin-treated rat did not fulfill a commonly accepted criterion for a valid behavioral animal model of schizophrenia. It is unknown whether the changes seen in capsaicin-treated rats were due to a somatosensory deficit during development or to a direct action of capsaicin on TRPV1 channels in the central central nervous system. Nevertheless, the neuroanatomical changes observed in the present study and the finding of a neurogenic component in the methylnicotinic plasma extravasation response indicate that the role of TRPV1 channels in schizophrenia is worthy of further investigation. Any questions?